Good morning to Gisela, to all those who make this broadcast possible, to our sign language interpreter, and above all to everyone tuned in to this briefing. Today we begin this press conference with the unfortunate news of the death of an 89-year-old patient from the municipality of Sancti Spiritus, and a confirmed case contact. The patient suffered from pre-existing illnesses, including hypertension and renal insufficiency, among others. The patient began to develop symptoms on October the 27th and was admitted to hospital the same day. He was given a PCR test, which came back positive for COVID-19. The patient spent a total of 8 days in hospital, 5 in intensive care. The patient suffered from a group of complications while being treated at the Manuel Fajardo Military Hospital in Villa Clara. Yesterday, November 5th, his clinical profile began to deteriorate, resulting in cardiac arrest, from which, despite the efforts of our healthcare professionals, it was not possible to revive him. We are deeply saddened by the death of this patient and send our condolences to his family and friends. Today, 967 people are hospitalized in Cuba. There are 683 suspected cases. 1,336 people are under observation, including 741 travelers who were all hospitalized. Yesterday, we processed 8,176 samples in our various molecular biology laboratories. Since the beginning of the pandemic, more and more laboratories have started to process samples. There are currently 17 across the country working to detect cases of COVID-19, including facilities in Santiago de Cuba, Holguín, Ciego de Ávila, Villa Clara, Artemisa, as well as laboratories in hospitals and research centers throughout Havana. Of the 8,176 samples processed yesterday, 44 tested positive for COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 891,877, of which 7,228, or 0.81% of people, have tested positive for the virus. If you could pull up the first graph, please, Lillian. Thank you. The pie chart shows the percentage of PCR tests studied from October 29th through November 5th. As you can see, 59,659 samples were processed from all of the country's provinces over this time period, for an average of 8,523 a day. The highest number of samples tested were from Havana, registering 41.9% of the total, followed by Pinar del Rio with 23.3%, then Sancti Spiritus with 8.5%, and Ciego de Ávila with 7.3%. As you can see, samples from all of the country's territories are being studied. Of the 44 positive cases diagnosed yesterday, 27 are the result of local transmission, while 17 are imported. 33 of the 44 cases diagnosed yesterday are Cubans, and 11 are foreigners. 25, or 56.8% of the 44 cases are confirmed case contacts. This means that 6,610 people, or 91.4% of all confirmed cases in Cuba since the pandemic began, had contact with someone who had previously tested positive for the virus. As I mentioned, 17 people diagnosed yesterday with COVID-19 contracted it abroad, for a total of 588 imported cases since the start of the pandemic. Meanwhile, it has not been possible to determine the source of infection in 2 cases diagnosed yesterday. That said, the source of infection in 30 cases reported over the last 15 days is still being investigated. Of the 44 cases diagnosed yesterday, 23 are female, representing 46.6% of all positive cases on the island, while 21 are male, representing 53.4% of the total. 37 or 84% of the 44 cases yesterday were asymptomatic at the time of testing. Overall, 61.9% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing. By age group, one positive case diagnosed yesterday is under the age of 20, for a total of 51 children or pediatric cases to have tested positive for the virus over the last week, and 829 since the start of the pandemic. Of these, 93.2% have recovered from the virus and been discharged from hospital. Meanwhile, 17 people to have tested positive for COVID-19 yesterday in the country are between 20 and 39 years of age. 20 are between 40 and 59, and 6 are over the age of 60. As I previously mentioned, 27 autochthonous cases were diagnosed yesterday, 23 in Pinar del Rio and 4 in Sancti Spiritus. The 23 cases from Pinar del Rio belong to the municipalities of Pinar del Rio with 6, Consolación del Sur with 5, Sandino 11, and Guane with 1 case. Yesterday, 3 cases were diagnosed in Havana, all of which are imported. These cases belong to Playa, Plaza, and 10 de Octubre. The 4 autochthonous cases from Sancti Spiritus belong to the municipalities of Trinidad with 2, Cabaiguan 1, and Sancti Spiritus with 1 case. Meanwhile, the 11 imported cases from Ciego de Ávila all belong to the municipality of Morón, and the 3 imported cases from Camagüey belong to the municipalities of Florida, Camagüey, and Guaymaro. Lillian, if you could pull up the next image, please. This shows the number of positive cases per province over the last week. As you can see, there have been spikes in the west and center of the island, specifically in Pinar del Rio, Ciego de Ávila, and Sancti Spiritus. Meanwhile, the situation in Havana is far more favorable, the result of the work and measures that have been implemented to date. Given yesterday's results by province, Pinar del Rio has the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 69.88. Next comes Ciego de Ávila with a rate of 26.54. Then Sancti Spiritus with 21.68, Altamisa 8.35, Havana with a rate of 0.70, Camagüey 0.26, Matanzas 0.14, and Santiago de Cuba 0.10. This means that Cuba's rate stands at 6.13 per 100,000 inhabitants from October 22nd to November 5th. To summarize, of the 7,228 people who have been diagnosed with the virus thus far in Cuba, 554 are active hospitalized cases. Of these, 550, or 99.3%, are clinically stable. Yesterday, 1 person died as a result of the virus, meaning that the COVID-19 death toll on the island rises to 130, with a mortality rate of 1.80%, lower than the global rate of 2.54% and the regional rate of 3.07%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 40 people were discharged from hospital, a negative result when compared with the number of confirmed cases yesterday. 19 people were discharged from hospital in Pinar del Rio, 12 in Havana, 4 in Sancti Spiritus, and 5 in Camagüey. This means that, to date, 6,542 people, or 90.5% of all confirmed cases in Cuba, have recovered from the virus. Today, 4 patients remain in intensive care, with 3 reported as critical and 1 as serious. This is the situation in Cuba. Now I would like to share some important information with you regarding the evolution and management of the virus here in the country. Since the start of the pandemic, 100% of confirmed cases and their contacts have been treated in Cuba. The majority of confirmed case contacts have been placed in isolation centers. However, given the current epidemiological situation in the country, it was decided 2 weeks ago that such cases will now self-isolate at home. Not one branch of our healthcare system has collapsed for even a moment during the pandemic. No pregnant women, children, or healthcare workers have died as a result of COVID-19 in our country. Over 700 studies and 16 clinical trials are underway to learn more about and combat the COVID-19 virus. To date, 53 medical brigades have been collaborating around the world to help fight the pandemic. The latest contingent departed yesterday for Azerbaijan. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 577,270 people were diagnosed with the virus, for a total of 48,171,603 confirmed cases since the start of the pandemic. Yesterday, 10,349 people died of the virus worldwide, for a total of 1,226,241 COVID-19 fatalities and a mortality rate of 2.54%. The region of the Americas, which accounts for 44% of all cases worldwide, reported 163,243 new cases yesterday, for a total of 21,239,715 cases to date. Meanwhile, 3,210 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 651,901 and a mortality rate of 3.07%. If we could see the next table, please, Lillian, we can compare Cuba's situation with that of the world. As you can see, the rate of confirmed cases and COVID-19 related deaths per 1 million people worldwide stands at 6,248 and 158.4 respectively. For the United States, the country worst affected by the pandemic, the rate is 29,598 and 724. Brazil, which follows the US among countries hardest hit in the Americas, has a rate of 26,238 and 756. Spain, which has been suffering for a while now, has a rate of 29,016 confirmed cases and 815 deaths per million. If we look at Cuba, the island has a rate of 634 cases and only 11 deaths per million. Turning back to Cuba for a moment, from October the 29th through November 4th, 551 people have tested positive for the virus. 1 person died, 333 patients were discharged from hospital, 5 people were reported as serious, and the same number as critical. As I mentioned before, 59,659 of a total 891,877 samples processed to date were studied over this period. Of the overall total, 7,228 have tested positive, with 321 diagnosed this past week. 418 Cubans and 0 foreigners tested positive for the virus during that period. Of these, 342 are confirmed case contacts, while 64 contracted the virus abroad, and the source of infection linked to 12 is still being investigated. 174 women and 244 men were diagnosed with the virus this past week. 314 were asymptomatic, while 104 displayed symptoms of the virus. This is the information we have on the pandemic in Cuba and the world.